Hello, my name is Cristina Ionuțiu. My ID number is N30349422. And today I will present the module Contemporary Issue. I would like to do in my presentation, I will focus on mental health sector of UK role and challenges it facing at present. A healthy population is one of the nation's most important resource. In addition to being valuable in and of itself, it also adds value to society. The long-term risks in mortality and life expectancy in the UK have stopped, and it is now falling behind other high-income countries. The current study will include the mental health sector in UK, as it's the only organization there which ensures the improved health of the people who don't have enough budget to pay their hospital dues. In this study, the status of mental health sector will be studied that how much burden the organization have faced due the issue arises in whole world. There are many contemporary issues facing the health sector here. The great impact on health sector of UK will be discussed and the reason behind the issue. Necessary solution will be made overcome the challenges regarding the service improvement in health sector. Now, I will discuss healthcare sector and the contemporary issue. Contemporary issue will be, I will talking about the health sector are the problems which are present currently in the mental health sector most commonly. The quality of services have affected a lot due to the challenges, and here are following challenges faced by health sector in UK. Medicine and equipment shortage, inefficient recording keeping, lack of social and healthcare workforce. I will start with the first one, medicine and equipment shortage. Equipment shortage in hospital causes catastrophic delays in critical surgery, like some patients who are waiting for a care experience lengthy delays as a result of work backlogs. This includes people with cancer who are constrained by dearth of oncology professionals and equipment, as well as individuals who must endure lengthy waiting lists for surgery or a diagnosis due to the same equipment scarcity. Now, the point 2 is inefficient record keeping. Poor record keeping causes unnecessary delays for patients. Healthcare workers may neglect to let patients know when their folders are misplaced or missing, choosing instead to keep them waiting. In the worst case, the patient's medical history is lost, which could result in more problems and incorrect diagnosis, and in very rare instances, the patient's demise. Lack of social care and health workforce. According to the most recent figures on the mental health care sector workforce, which were realized in June 2021, there were more doctors and nurses working for the mental health care sector than there were a year earlier. According to the most recent mental health sector vacancy figure, there were 133,446 open position in September 2022, representing a 9.7% vacancy rate. COVID-19, it was multiple healthcare interruption were brought on by the adoption of COVID-19. Depending on the nation, the most severely impacted services saw a 26 to 96% drop in cancer, TB detection, and HIV testing. Screening for breast cancer was significantly impacted. About half of the countries experienced disruption in mental health services, with decreases ranging from 5% to 33%. Analysis of key perspective. Now I will explain LO2, which is analysis of key perspective and its impact on care delivery. Poor technology implementation. It has been observed that the record keeping was not up to the mark, and the healthcare sector have faced many issues in treating and diagnosing the disease of the patients without knowing the historical background. Due to the lacking of technology implementation, the health sector have faced the issue of record keeping. Patients don't typically consider the administrative aspects of healthcare. Lack of training. Here are following issues that the health sector have faced due to the lack of training among employees. Breaches in data security and privacy. Insufficient paperwork affect reimbursement. Compliance hazard. Risk to patient safety. High work turnover and low morale. Legal problems. I will discuss about LO3, the potential outcomes to reduce service disruption due to the contemporary issue. Drive quality care. Clinical outcomes and care quality are intimately correlated. The more knowledge carriers have, the higher the likelihood of high quality care. Healthcare system must come up with new strategies for detecting at-risk patients, cutting down on hospital stays, and enhancing care delivery as these models take shape. Optimization of clinical workflow. The patient's healthcare experience and healthcare result can be transformed by integrating cutting-edge health technology and good solution into clinical operation. With the help of these technologies, partnership can be strengthened, administrative procedure can be automated, and workload of clinicians and staff may be lessened. LO3 potential outcomes to reduce services disruption due to contemporary issue. Government action. The government must improve and maintain the current system, which is danger of collapsing, in order to handle concern with hiring and keeping staff members, to improve the funding system fairness and give the government protection from social care expense. More fundamental reform is required. The government will need to increase overseas recruitment and up to 2023-2024 to prevent nurse staffing shortage from seriously impeding the delivery of the mental health care sector long-term strategy. And in the conclusion, the healthcare sector has issues globally, but UK have affected the most. The most common issue that are facing by the health sector in the way of improvement are the lack of funding, shortage of medicine and equipment, inefficient record keeping of patients, and shortage of staff. The reason behind these challenges faced by the issue are the COVID-19, poor technology implementation, and lack of training among healthcare professionals. The potential measures to overcome the challenges are the government action, optimization of clinical workflow, drive quality care, and reducing health costs. Thank you very much.